Hey everyone, welcome to Smart Course, the go-to place for authoritative information and strategies for special needs and learning disorders, especially ADHD. We're going to help you deal with ADHD meltdowns and tantrums right away. So you have strategies to use at home, and you don't have to read a bunch of random articles online. These are the same strategies used and recommended by Healthline, Healthy Place, and Psych Central. First, we're going to define what an ADHD meltdown is, share the reasons why so many kids with ADHD have meltdowns, and lastly, the solutions we recommend for parents and for kids to use themselves. Today, you are going to learn about the new topic, ADHD meltdown, that's actually bad for you. Many people experience meltdowns, including children with ADHD. What is a meltdown? A meltdown or a tantrum is actually not a clinical term. It is considered a form or manifestation of an anxiety disorder. It arises from overwhelming stress and varies in symptoms. They're not uncommon, but attention deficit and anxiety disorders can sometimes result in a higher chance of occurrence. Your child may be experiencing a meltdown when they lose control of their emotions and ability to think clearly. Some people might suddenly feel blank and numb, unable to process information, or even more. Others might experience sobbing or angry outbursts. While experiencing a meltdown, children may also withdraw from family, friends, and classmates. They may avoid social functions and engagements, eat and sleep poorly, maintain poor hygiene, calling sick to school for days, or not show up to school at all, and isolate themselves in their home. All sorts of life events can contribute to a meltdown, from negative peaks in mental illness to regular events in life, such as getting a low grade. They can even be triggered by things that would normally seem like nothing, but sometimes it can be the straw that breaks the camel's back. Triggers can come from both counterable and uncounterable factors. Other risk factors that can increase the likelihood or frequency of meltdowns include a personal history of anxiety disorders, a family history of anxiety disorders, a range of mood disorders, or recent injury or illness that makes children's life difficult to manage. Why do so many children with ADHD have meltdowns? There are many reasons. First, children with ADHD deal with lots of stress because their ADHD can cause memory, impulse, and organizational problems. And those problems tend to occur on a daily basis. Second, young children are emotional, sensitive to rejection, and have trouble regulating their feelings. To be more specific, ADHD frequently overlaps with other conditions, such as depression or anxiety, heightening their vulnerability to overwhelming emotions. So, while there are still studies being done on ADHD and the production of the stress hormone cortisol, children with ADHD widely report feeling stressed out. Then, how can they and their parents deal with this situation? The most important thing is to train their self-care skills. Self-care makes them function more efficiently and can help prevent, or at least manage, mental health crises. Lifestyle modification can also help lessen the variety and frequency of them. Build a healthy schedule for a child and get them regular exercise at least 3 times a week. You can just simply walk around your neighborhood for 30 minutes. Make sure they sleep regularly for at least 6 hours a night. Remember to go to a therapist or attend counseling sessions. With professional help, your children can learn some stress management techniques, such as relaxation techniques like deep breathing, that they can implement into their daily routine. Talk with your middle schoolers about drugs, alcohol, caffeine, and other substances that create stress in their bodies. health and sex education will also help them safely navigate the society and emotional complexities of adolescence. A child who feels a sense of social support is less likely to engage in risky behaviors, so encourage participation in sports, clubs, and other group activities. You can also teach your child how to write things down and read their body skills. Make and manage a list of what they need to do, or write in a journal. Observe what is causing stress, note what times and situations make them the most tense. The more they check in with themselves, the more they will be able to observe when they're really becoming frustrated or afraid. If they're going through a tantrum, try to distract your child. For younger kids, it may work by just talking about something completely different, such as a TV show. Or you can try to ignore their tantrum. Even negative attention is attention. It gives a payoff for their behavior. Sometimes the best reaction to a tantrum is no reaction. For managing their symptoms, you can make an appointment with your primary care provider or a complete physical examination to make sure that their symptoms are not being caused by a medical problem. Taking prescription medications such as antidepressants or anti-anxiety medication can help to treat symptoms. Many parents may be confused about when to see a doctor. Here is my suggestion. It's not uncommon to feel unable to cope with life stresses at one time or another. But a child with ADHD may have more difficulty dealing with stress and doing their daily tasks than children without ADHD. It's important for parents to take their child to see a doctor early because a meltdown might be a sign of mental health disorder. Lastly, meltdowns are not uncommon for children with ADHD. With the right help and early intervention, your child can manage their stress and prevent meltdowns. In our upcoming video, we'll be discussing the problems children with ADHD may experience with their emotions and mood. For an expert curated list of resources from our past summit and videos, in particular, everydayhealth.com, 8 steps to stop your child from having an ADHD meltdown, please visit the link in the description. To make sure you're as prepared as you can be, I want you to hit the notification bell below and join our newsletter because we'll be sharing much more resources on how to help your family cope better with ADHD, both at school and at home. If you like this video, please don't forget to like it. And let us know what you liked or would you like to see more of in the comments below. The more people like, subscribe, click the bell, and comment, the more people will see this kind of content on YouTube. And we know some people could really use the help. If you haven't watched our previous series about the best music for the ADHD brain, click the annotation on the top right of the screen to watch those videos. We'll be sharing information about upcoming videos on this YouTube channel and exclusive deals in our newsletter. So again, hit the notification bell and the subscribe button under this video and sign up for our newsletter using the link in the description to get early access to and exclusive deals on our resources. For even more specific information, step-by-step guides, and access to professionals who can help you through this process, please sign up for our online course or upcoming summit in August using the links in the description. We share tons of expert-vetted resources on parenting and education for differently able kids, just like kids with ADHD. So make sure to check out our previous videos and subscribe to our channel to receive notifications for videos to come. As always, I appreciate you taking the time. Thank you for watching and see you soon.